Urolithiasis, or urolithiasis, is a multifactorial disease characterized by the formation of solid conglomerates of various chemical composition in the urinary system. The pathogenesis of urolithiasis is complex and includes metabolic disorders, infectious processes, anatomical features of the urinary tract and other factors. The localization of concrements can be diverse: kidneys, ureters, bladder. It is worth noting that the onset of the disease is often asymptomatic, especially when the stones are localized in the upper urinary tract. Only with an increase in the size of the stone or its movement do characteristic clinical manifestations occur. The most common symptom is renal colic, caused by the movement of the stone through the urinary tract. With a long course of the disease, complications such as pyelonephritis, hydronephrosis, sepsis, and chronic renal failure may develop. The mechanisms and causes of urolithiasis are well known: urine supersaturation, increased concentration of calcium, oxalate, urate, and phosphate salts leads to urine supersaturation and crystal formation. Change in urine pH. Changes in acid-base balance contribute to the crystallization of certain types of salts. Presence of crystallization nuclei, epithelial cells, bacteria, and foreign bodies can serve as nuclei for salt crystallization. Violation of inhibitory systems. A decrease in the concentration of substances that prevent crystal growth, citrate, magnesium, contributes to the formation of stones. Urine stasis. Slowing down the outflow of urine creates conditions for the concentration of salts and the formation of crystals. Risk factors may include hereditary predisposition to stone formation. Metabolic disorders. Metabolic disorders: hyperparathyroidism, gout, diabetes. Dietary factors: abuse of protein foods, salts, oxalic acid, lack of clean drinking water, dehydration. Deficiency of vitamins A, B, E, K. Alcohol abuse. Overdose of vitamin D preparations. Urinary tract infections, cystitis, prostatitis, pyelonephritis contribute to the formation of infectious stones. Anatomical features. Anomalies of the development of the urinary tract, obstruction. Climatic factors: hot climate, dehydration contribute to the formation of stones. What are the treatment methods? Anti-inflammatory drugs. According to the latest recommendations, it is necessary to start with non-steroidal anti-inflammatory drugs first. Antispasmodics come in second place. Spontaneous passage of stones from the urinary system can be facilitated by taking alpha-1 blockers. Antispasmodics, to relieve pain during the movement of the stone through the urinary tract. Drugs for correcting the pH of urine, to create unfavorable conditions for the growth of stones, citrates, phosphates. Phytotherapeutic agents, as an auxiliary method of treatment, as prescribed by a doctor. If the infection is confirmed by urine culture, it should be treated according to the antibiogram. Control urine cultures are always indicated. Prevention of urolithiasis involves a set of measures aimed at preventing the formation of stones in the kidneys and urinary tract. The main recommendations include drinking regimen. Drink sufficient fluid, 1.5 to 2 liters per day, to dilute urine and prevent the concentration of salts. Nutrition. Limit the intake of salt, animal protein, oxalic acid, spinach, rhubarb, nuts. Increase your intake of foods rich in citrate, lemons, oranges, which prevents the formation of stones. Control your weight. Being overweight increases your risk of developing urolithiasis. Physical activity. Regular exercise helps improve your metabolism and prevents urine from stagnating. Drug therapy. In some cases, your doctor may prescribe medications to correct your metabolism and prevent stone formation. Control your comorbidities. Diabetes, hyperparathyroidism, and gout can increase your risk of stone formation.